to a new video. I am starting a new series where we are going to talk about chopping off the tatas. We're going to start this new series talking all about breast reduction surgery because as I have been researching breast reduction surgery, I have found that there is not a whole lot of content on this in compared to other topics. Therefore, I am going to create my own videos on my breast reduction surgery. So if there are any other fellow big-breasted mermaids out there that don't quite fit into their seashells anymore and are more like a G shell, H shell, J shell, you know, whatever, maybe they'll find something like this helpful. Now, if you're a mermaid that still fits in your seashells just right, then this video probably won't be that interesting to you. But if you have any mermaid friends that don't quite fit into their seashells, send them this video. Maybe this will help them. I had my very first consultation with my plastic surgeon on Friday, so today I wanted to talk about what I talked about with the plastic surgeon and some of the questions that came up and what her answers were for my situation, and maybe it'll help some of you guys, or at least kind of give you an idea of what questions to ask your own plastic surgeon if you are considering a breast reduction. So, first things first, is a breast reduction right for me? I wear anywhere between an H and a J cup, kind of depending on the bra, so I was pretty sure that a breast reduction was right for me, but I won't lie, when I walked into the doctor's office, I was a little worried that she was gonna be like, oh no, you're probably that's not a good idea for you, or you don't really need it, and I would have walked out of there hysterically sobbing and probably turned into a sloth for the rest of the day. So I'm really glad that that's not how mine went. So I tootled on into my doctor appointment and sat down, put on the fancy little robe, which they had me wear backwards, and I don't know why, but that weirded me out, even though it makes sense. She took one look and said, yeah, I'm pretty sure you mark off all of these things, but just in case, here's the checklist. Do you have sore pain in your back? Do you have sore muscles in your shoulders? Do you have neck pain? Do you get headaches? Do you have numb or tingling extremities and fingers? Fingers are extremities. Do you have numbness or tingling from your breast pushing on your arm? Do you have soreness underneath from your bra or breast pushing on your ribs? Can you do daily activities like exercise, sleeping on your back, sleeping on your front? Do you get skin irritations underneath the bra line? Do your friends call you Bazooka Jess or Jessica Jugs? Yes, 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 yes. Pretty much I checked off everything on the list. So if you checked off any of those, a breast reduction might be right for you. Talk with your doctor. My doctor took one look at me, and before I even finished checking off the list, she said, yes, you are the perfect candidate for a breast reduction. And I don't know, I didn't think I would be crying, but I was crying tears of happiness right then. Of course, my next question is, how exactly is this surgery done? And it's really hard to explain, so we're gonna draw a diagram. You guys are gonna be so excited about my art skills. I'm a true artist. So basically, you have your body. Whoop. This is not my body. My body doesn't look like this, but a body that needs a breast reduction. What the surgeon does is they come in, they go around the nipple while keeping it attached down the front and then kind of along this underside right here on both sides. And then they remove some of that excess tissue and kind of lift it and place it where it needs to be. This is the standard procedure to get perfection in most cases. However, I am an exceptional specimen, so the standard procedure won't work for me. For me to be able to do that standard procedure, they will only be able to get me to a triple D, which is are you serious? A triple D, and that would be my small boobs? I don't think so. Not gonna work. To which my doctor said, I've got a solution for you. Basically what they're gonna do is kind of along the same procedure as far as going around the nipple, down, and then underneath, but instead of keeping it attached, they completely remove the nipple, and that allows them to go in and remove as much tissue and everything that they want to be able to reshape it and put it in the place that they need it to be. For someone like me who needs to go down more than just a couple of cup sizes, this is necessary. It does have a few drawbacks. It means that I will never be able to breastfeed again in case I have any future children. Heaven help me if I ever get pregnant again, but you never know. So I won't ever be able to breastfeed again. I will also never regain sensation in my nipples or that exterior part of my breast right there. And the scarring can be worse because it does come up a little bit higher on the sides. And your nipples, I guess, look different. It's called a nipple graft. Once they remove the nipple, it basically becomes like a skin graft. So they put it back, but it doesn't function the same way that it did. Whereas if you just have the standard procedure, usually they can get you pretty close to where you're going, or like where you want to be, as long as you're not like Mount Everest and Mount Doom like I am. But if you're like a double D and you just want to go down to like a C or something, my doctor said usually that they will perform the other surgery. So, I don't know. Talk to your doctor about what's right for you. Next subject. This is going to be for those ladies that are a little like me and have a little more pushing for the cushion. So, if you are overweight and planning to get a breast reduction surgery, there are some things to know with weight loss and breast reduction. I've been on my weight loss journey, you guys all know that, so I was concerned about how that was going to affect my reduction, and my doctor basically told me I have two options. I can either lose the weight and then get the surgery, or I get the surgery now and then lose the weight. So the nice thing about losing weight first and then getting the surgery is that I can get my reduction done to the size that is going to flatter my post-weight loss body the best. So it's more preferred to do that. However, it is extremely difficult to lose weight if you have boobs as big as mine are. And the reason for that is because you can't really exercise very well. I mean, if I go to the gym, it's like I'm pretty much walking around like, ugh, I'm injured. My boobs are dragging behind me like Neanderthal arms. I'm all sweaty and swampy, which leads to skin irritations, not to mention that I'm like hitting myself in the chin if I try to do anything remotely like running or pretty much anything besides swimming. And if I turn around too fast or something, I'm worried I might knock someone else's eye out. Not to mention the work it takes to get to the workout. Do you know what it is like to have to strap yourself into this tiny little workout bra, and then you have to tape yourself down and then put on another workout bra? And guess what? I am still bouncing around. The divots in my shoulders literally have like broken blood vessels and stuff after I work out. And then beyond that, the back pain is like, oh, I can't even. It hurts so bad. It feels more like I'm injured than just sore from a workout. So it's extremely difficult to work out besides doing like light walking or whatever. And a lot of people do get breast reductions so that they can work out to lose weight. So the doctor said that if you choose to do that, which I plan to, it will help me be able to exercise easier so that I can move forward with losing weight. If for some reason when I lose weight, I lose too much of my breasts or I'm like too small at that point, I could go back in and have a lift done or something like that. Anyway, so that's an option. And I know what you're thinking. Wouldn't it be better to just lose weight and then my boobs will go away and avoid the surgery altogether? That does sound like a good idea, but that is not how it works. I have a lot of breast tissue, so losing weight does not make that breast tissue go away. It maybe loses the fat, but keep in mind that I started wearing a bra when I was 8 years old. I was maybe 9. I started wearing a bra at 8 or 9 years old. By the time I was 13, I was in a C cup, and by the time I graduated high school, I was wearing anywhere between a G and an H, and my band size was still only a 32. So I was very thin and I just had large boobs. It has been kind of the one thing about being overweight that has been a benefit. My body actually looks more proportional to my breast size versus being like this little tiny thing with gigantic boobs like a porn star. Because all 18-year-olds want to look like a porn star, especially in high school. Kids are so nice. After the reduction surgery, what comes next? Recovery. That was one of my biggest points in talking with my doctor because I don't want too much downtime. Or maybe I do. Maybe I do want to spend 6 months in bed. That would be Well, no, that would be horrible. But it would be nice to have a couple of days. My doctor told me that 7 to 10 days is pretty typical for taking it really, really easy. Usually you have drains for a couple of days, and then they just want you to be really careful with things that are like pulling and tearing motions. So things like vacuuming or like bending over to pick up a baby out of a crib or reaching for things, and that kind of motion that is going to cause pulling or stretching on your arms or this area. She said, do you want to try to like avoid those things? Because you don't want any seams popped. Because you don't want to like tear any seams or pop any stitches, or I don't know what the term is. I think of popping stitches and I think of like moving and it pops out like rubber bands from your braces and hits your neighbor in the eye or whatever. We don't want any of that. It's about 6 weeks when you are considered like recovered enough to resume your normal activity, and then at 3 months you're like totally feeling great, scars healing nicely, that kind of thing. At least that was my understanding of it. I guess I could have misinterpreted, but that's what I had written down. Sydney! Sid, stop! Children, they're so noisy. Oh gosh. My back hurts even just sitting here making this video. Like, I'm not totally sitting back against the chair and I'm like, ugh. And it's only been like 5 minutes. Do you guys want to have a guess at what my final question for my doctor was? Yes! Insurance! Will insurance cover it? And if they don't, what is this gonna cost me? Ew, I think I just spit. Gross. Sorry guys. What is this gonna cost me? Or is my insurance gonna cover it? I don't know what it's like everywhere else in the world, but in the United States, we have the lovely pleasure of working with insurance companies, and it is quite the game. Everyone loves games, right? Right? So, insurance. With my particular insurance company, they require me to like meet a whole bunch of things. So they want a record of everything that I've done up through this point to try to resolve my breast issues, I don't know what to call them, but my boobage problems. So I had to submit, or my doctor is going to submit. I don't do anything. My doctor submits to the insurance all of my medical records where I have had issues with my breasts. So things like headaches, the back pain, chiropractic work, physical therapy that I've done, my dermatology report for the skin issues or the skin irritations and stuff that I get, the numbness in my fingers, all of it, basically everything. And then they submit it with pictures as well that they took there at the doctor's office. Oh, side note, pictures, warning, they do take pictures. And I guess a lot of people are uncomfortable with it. I didn't think anything about it. I mean, it's nothing like crazy sexy and glamorous. It's more like you just are topless in front of a wall, and they usually cut your face out and then they just send that to the insurance, and then they use that for their own records for when they're prepping for your surgery. They can kind of shape you and like mark where they want to put things in and shape you, and kind of like, it's like their research. You know what I'm saying, right? That I don't even know what I'm trying to get out of my mouth because it's not coming out. The point is, you will probably have to take pictures, and you can also request to look at their portfolio to make sure that that their after photos are at least appealing to you, so you're not worried about having these wonky boobs and having wonky boobs for the rest of your life, because who wants wonky boobs? If you see something and you don't like it, and like the majority of their work you don't like, call that doctor a quack and keep on walking. Find a new doctor. Researching your doctor is very important, and it's your body and how your body looks and how you're gonna feel. So make sure you do your research. And side note, back to insurance. So they get all the documentation, at least from my company, and they submit it, and then once the insurance makes a decision, then I'll be able to schedule my consultation. So my insurance company takes anywhere from 4 to 8 weeks to get all figured out and either approve me or reject me. So I will know in somewhere in 1 to 2 months. And then my doctor in particular schedules out about 3 to 4 months in advance. So it's very possible that from the time I am uploading this video to the time I actually have my surgery, it's gonna be several months. But that's okay. I wanted to make the video anyway and kind of document everything that I'm going through. and just share with you guys so we're all on the same page. And it's kind of fun to do something different than like, I got on the scale today and I'm so fat. So, you know, I think this is like a fun, I'd like to do more of these. If my insurance comes back and is like, please, you're perfect already, we're not going to cover this surgery for you. My doctor told me that it would be anywhere between $6,000 and $10,000 for the surgery itself. And I believe that that varies based on the medical network and doctor that you're with. So that is going to be a very personal question to your situation and your doctor that you're going to want to talk with them about. And I think that about covers it for everything that I talked about in my consultation and all of the main questions that I had and what the answers were for my situation. So again, if this video doesn't apply to you, consider yourself lucky and send this to the friends that you have that it does apply to. I think I just spit again. Whoops. Send this to your friends with the big boobies that want to get them cut off someday. And don't forget to subscribe below if you are new here and if you want to see more about the breast reduction journey. I don't know that I could call it that, but the breast reduction journey that I am on, and you can follow along with me. And I will see you guys on Monday or Tuesday. I don't know. I'll see you in the next video.